We're here today to talk about different ways to tackle Parkinson's from a natural perspective. I'm joined with Dr. Rosalie de Lombaert, and I'm Dr. Molly Force, and we are naturopathic physicians who practice out of Prosper Natural Health in Port Townsend, Washington. We are functional medicine experts, and as functional medicine doctors, what we're really trying to do is get to understand the imbalances that are going on for our patients and figure out specific individualized treatments. And sometimes that involves different testing, and oftentimes it involves a lot of different discussions that we're having with our patients. One of the things we like to offer our community are these doc talks, which we post on our website, prospernaturalhealth.com, and we try to talk about relevant topics for folks. So, jumping right into it, today we're going to be talking about Parkinson's disease and the Parkinson-like syndromes. Now, generally, we think of Parkinson's disease as a progressive, which means more of a chronic, degenerative neurologic condition. We associate this with the loss of these neurons that produce dopamine, and dopamine is a very important signaling chemical for the brain and the nervous system. With this, we start to see different changes for people. Many of you may already know this. A very associated symptom is a tremor, or we call it pill rolling because we start to get these tremors with our hands that happen. There can also be rigidity. We start to see masked facial expressions and postural instability, so difficulty with balance. Some of the first signs that will show up for people can be things like constipation or reduced arm swing. So we start to see these motor coordination issues. Oftentimes we also see changes with mood like anxiety and depression. Things like restless leg and sleep disturbances are very common. We also see a decline in smell and capability of discerning certain scents. And a lot of this is often happening because of these proteins that become misfolded, and as that happens, they start to aggregate, which means they begin to loop together and clump together. And so this is what we call in science the alpha-synuclein aggregation. And when that happens, we get progressive more and more dysfunction for the neurologic system.
So, in terms of some strategies here for tackling Parkinson's, an often overlooked one is just the sleep optimization and stress reduction piece. This is kind of like laying the groundwork for all the other stuff that we'll talk about later here. This is a necessary piece for supporting neuroplasticity, which is that amazing ability for the brain to change and adapt within the context of stressors, whether they're physiologic or psychologic, right? So just to plug in for making sure that your garden is ready here in terms of sleep optimization, meditation, your mindfulness practice, breath work, or any Ayurvedic breathing known as pranayama. Social engagement is huge, right? We think about dopamine when we have our social engagements. And then, of course, as naturopathic physicians, we're, of course, excited about nature exposure, forest bathing, the healing power of nature. So some dietary strategies here in Parkinson's disease is, of course, there's an application for the Mediterranean diet. We hear this a lot with our cardiovascular conditions, but there is a Mediterranean type diet known as the MIND diet. It's the Mediterranean Dash Intervention for Neurodegenerative Delay. So there is the same concepts of Mediterranean type diet, which are optimizing our antioxidants and maximizing plant-based fats, right? As well as in the MIND diet, some salt mitigation and some particular neuroinflammatory support with added fats in particular. So practical nutritional strategies here, of course, include looking into that MIND diet. This will include some anti-inflammatory foods, polyphenol-rich foods, your berries, your olive oils, your green tea, your herbs and spices, as well as high-fiber foods. This is the vegetables in particular that are going to hold the highest role here. Foods to limit are ones that are neurodegenerative in general. So ultra processed foods, extra packaging, right? Excess sugar, any refined carbohydrates. These would all be definitely inflammatory to the brain in a Parkinson's patient.
We're really excited to share with you much of the new information that's coming out about the gut-brain axis, and that means this communication that happens between our brains and our GI system and how that can impact things like Parkinson's disease. So we have seen in the medical literature that there are lots of studies coming out starting to talk about how the microbiome composition, so this is what we're talking about when we're talking about probiotics living in the GI tract, how the composition of those can really be impactful for these neurologic conditions. We know that intestinal permeability, which is another fancy name for leaky gut, and inflammation may contribute to the speed of neurodegeneration in some of these chronic conditions. So that's really important for us to think about. And we also know about this communication now that's happening between the brain and the gut. So one of the things that we're thinking about for our patients that are dealing with Parkinson's disease is the importance of their GI health, how we can reduce intestinal permeability, reduce inflammation, and support them in that healthy gut-brain axis. There are many different microbiome supportive therapies which we utilize. Many of you have heard of probiotics, which pro means for, biotic, life. These are the microbes that help us. There are symbiotic bacteria or commensal bacteria mainly that live in the GI tract and all over our bodies. We also have prebiotics. Now, pre means before, so we're saying before life. These are the foods for our probiotics, for our microbiome. And we want to make sure we're including these foods that protect and support the environment needed for and the food provided for these probiotics. And then we have things called symbiotics, and these are things that help also that terrain of the GI system so that the microbiome can survive properly. And we know that different dietary modification can impact that. Simple things like pH shifts and fiber allotment can really drastically impact the microbiome. And there are studies coming out about how each of these are impacting Parkinson's disease. There are also studies now looking at the possibility of fecal microbiota transplantation. That is this technique where essentially stool from one healthy individual is transplanted into a person that's needing a microbiome shift. And this is now done very cleanly within a lab and is done usually through a hospital setting. And it provides for a big overhaul of a microbiome. So if a GI system is really out of balance and progressing towards more inflammatory state, shifting that microbiome can be a very powerful option. Here's some interesting research that just came out in 2024 regarding diet and the gut microbiome, specifically in patients with Parkinson's disease. And the big takeaway from this is a lower sugar diet with high fiber really supports something called the butyrate production. Now, butyrate or butyric acid is made by the GI microbiome, so those microbes, and it's a protective layer, almost like an icing on a cake that protects the colonocytes, the cells of the GI system. And it's very important for that micro layer to be intact so that we don't have proteins and other inflammatory substances coming through and triggering an inflammatory response from the immune system. We know when that can happen, we get more concerned about speed of this neural inflammation and that connection once again between the brain and the gut. If there's imbalance in the gut, we start to see more imbalance in the brain and speed of degeneration.
So, moving on from diet here, there are some other applications in terms of lifestyle therapies. So, especially important here is movement practice as medicine. So, there is a whole organization here known as Dance for Parkinson's that is based off of this finding is that patients who move more, who continue the movement despite having the diagnosis of Parkinson's, if then they continue to move and continue to dance, they have a diminished loss of that known as it's called bradykinesia. So it's just like the loss of like ability to move, like the arm swing, etc. Right? So continuing to keep your movement practice, your body flowing is huge here. It improves your balance, it reduces fall risk, it supports your mood, right? We're getting those endorphins and kephalins when we move. It enhances that neuroplasticity again, and definitely we see disease modification with movement practices. Here's an exciting article on Tai Chi in particular as a movement method for improving balance, mobility, gait in patients who have Parkinson's. So, this research article showed the Tai Chi group in particular had more improvement than the control group who didn't do Tai Chi in this particular metric that is the scoring method for how severe the Parkinson's symptoms are. So, gosh, on so many levels, there's 5 or 6 different ones here. We saw an improvement in that Tai Chi group as compared to the control group.
We want to talk about the energy production of your cells when we're thinking about a chronic degenerative neurologic condition. The mitochondria, which is that powerhouse of the cell that helps with energy production, is incredibly critical. And one of the things we see when we start to look at some of the evidence about different supplements, different minerals, and different nutrients and antioxidants that can be helpful for Parkinson's disease is we often see that these will fall into the category of being mitochondrial supportives. So remember, in order for a cell to have energy, it requires some precursors. This means it requires some glucose, so base glucose, that's also known as sugar. It requires ketones, which is another form that the body can take food and either break it down into glucose or into ketones for energy. Obviously, we are not saying eat table sugar or a whole bunch of sugar because we talked about how that was pro-inflammatory. But we need these base pieces of glucose in order for the cell to function, and then oxygen. So we need to be breathing. So as Dr. Rosalie was saying, the movement piece is absolutely critical. We want to remember with that to do the breath work as part of that because that oxygenation is so important. And when we think about Parkinson's fatigue, that is a major issue for so many of our patients. We also know certain antioxidants can help with the cell function in regards to our mitochondria. Glutathione is probably one of the best studied for that. And then we have all these cofactors. You'll see several B vitamins listed here, as well as vitamin C and K, ALA and carnitine, and even calcium and magnesium are important for the mitochondria to function. And what that kicks out is ATP, which is cellular energy. Now, this is important because when we start to look at nutritional supplements that help the mitochondria and help Parkinson's, there are several that are commonly studied, and we really see a lot of these falling into that category of both being supportive for mitochondrial directly through energy production and others that are supported as antioxidants. We see research on omega-3 fatty acids, CoQ10, which many of you may have heard, especially if you're on statins or a cardiovascular patient, vitamin D, curcumin or turmeric, NAC, and then there's our magnesium. We're going to talk about velvet bean or mucopurines in a minute. And there is a really important division here between different supplement qualities. So we will always want to say we want to make sure that we're providing our patients and our community with the best quality supplements. There's such variability in the marketplace because they're not well regulated. So we want to make sure we're getting physician grade whenever we can. And that means that they've been tested against a third party that's come in and done quality control testing. And we also want to make sure that we're really individualizing which nutrients are coming in with those recommendations, because not every Parkinson's patient is going to be the same. So here we see really interesting research on vitamin C that we wanted to make sure we shared because it's used so frequently with our Parkinson's patients. And what we see here is that vitamin C can actually help with the ability for specifically levodopa, which is a very common Parkinson's pharmaceutical. In fact, most Parkinson's patients are on carbidopa at some point in their treatment, if not throughout their entire treatment once they've been diagnosed. And unfortunately, with levodopa, what we see is eventually over time, the effectiveness decreases. So one of the really neat pieces here is this study just looked at what happens when vitamin C comes in at the same time as levodopa and how it can actually enhance the levodopa's effect, which can help for people who are getting diminishing returns when they're taking their levodopa over the course of many years. So this study used a very small amount of vitamin C, only 200 milligrams per dosing with each dose of the levodopa. So this is not a huge amount of vitamin C. It's very important that you work with your doctor in or your care provider in getting this added on if it's something you're looking into, but make sure you don't miss out on some of these simple strategies to help out.
So just to reiterate here that dopamine is a huge part of what's going on with Parkinson's disease. Dopamine is depleted in Parkinson's, and it has to do with a progressive degeneration of the nerves that are dopaminergic, which means that's their action is to move dopamine from one area to the next in a particular spot in the brain known as the substantia nigra. So as dopamine is depleted, remember dopamine is our neurotransmitter that's there that gives us the sense of reward. We get symptoms, right? Notably motor symptoms. You have to have 50% of your dopamine depleted before you start to have these motor symptoms, which is right, we're kind of an amazing number. Like we could make some changes before we get to this 50% depletion. Our most severe Parkinson's patients are working at 10% ability, which is why that levodopa prescription, a dopamine analog, gets used. It's like, how do we replete the dopamine? So, of course, multiple neurotransmitters are involved, dopamine being the center point here, but we're also thinking of deficiencies in serotonin, acetylcholine, norepinephrine, which is why some of these symptoms of Parkinson's are not alleviated by just a dopamine analog like the levodopa. So speaking of dopamine, there are some natural ways that we have seen to increase dopamine levels. One of them is an Ayurvedic herb known as Mucuna pruriens or velvet bean. It does indeed sequester dopamine, right? A significant amount per bean is about 4 to 6% per bean. So we can extract that, and we have an herbal product that is dopaminergic, meaning it has a dopamine action. What this review saw was that, yes, we see an improvement in the patients who are taking velvet bean. In terms of their Parkinson's symptoms. So it shows promise. This isn't necessarily meant to replace the prescriptions, but it can be used as an adjunctive therapy. Also helpful here is an amino acid known as citicoline. Right? Citicoline is well known in terms of its effect on preventing neurodegenerative disorders. and not just in Alzheimer's, but also in Parkinson's. It also increases dopamine availability. So not only are you having a neuroinflammatory change, which is great, it's supporting that neuroplasticity, but you're also having an added effect of increasing that neurotransmitter dopamine.
Many of our patients are looking for information about some of the scheduled substances, which can be harder to access for some of them. And the research is just now starting to really come out about several of these. So we thought we would share some of the newer information about some of these more challenging treatments to consider, such as psilocybin, which many of you may know as psychedelic mushrooms. And then also, we're going to be talking about CBDs and THCs today. So, when we're talking about psilocybin, we should say these are trickier to access in many states as far as treatments because of the regulation. They're still federally not, they're still not very accessible for most. What we find is kind of the beginning of some promising research. And I will say there's not quite enough yet to really know for sure. In fact, we only have one research study of 12 participants that's a human study for Parkinson's specifically with psilocybin. But there are many animal models out there. And what we're seeing in this study that was published in 2024 is actually looking at the comparison of psilocybin to metformin. Now, many of you may have heard of the word metformin or the drug metformin because it's a very common diabetes treatment medication. And what's interesting about metformin is there's an unscheduled use of it then that is not approved through the FDA for Parkinson's disease. There are some physicians and providers that utilize it for Parkinson's disease control. And one of the things that the research has shown for metformin is it's suggested that it can halt some of the progressive activity of Parkinson's disease. And the thought behind that is that it's reducing the oxidative stress, meaning it's an antioxidant. It's reducing the inflammation and helping the mitochondria of the body work more effectively. So there's less alpha-synuclein damage. With psilocybin, on the other hand, these researchers are suggesting that it may actually help with repair of the damaged neurons. And they believe that this is happening through a neuroplastic activity through the serotonin pathways. So, slightly different pathways than our dopamine pathways, but it's basically this understanding of kind of rerouting that neuroplasticity that we see. So, interesting research coming out about this here. Certainly more and more providers and patients interested about psilocybin, and we'll be interested to see what the next few years of research shows. In regards to THC, there are multiple randomized controlled studies, and those are kind of considered the top tier in regards to the scientific research, looking at how THC and CBD, being some of our top two most active components in cannabis, how they can be helpful for Parkinson's. So what we did is we provided charts here for you to refer back to. And it kind of goes through the different symptoms that a Parkinson's patient may be experiencing or different goals that they might have. Maybe they have a lot of pain, and that's the number one goal for their treatment. And so looking and seeing which of these chemicals that are within that cannabis plant might be a better match for them. Now, once again, THC is not even accessible in all 50 states, I don't believe, at this point. So it can be harder for some patients to access. But here's, for example, some of these findings. We see that the non-motor symptoms, so that's the things like how well sleep, is being treated, and anxiety. We see a significant improvement in those from THC, whereas the motor symptoms, that'd be like the tremor that we talked about, or that bradykinesia, that slowing of the motor movement and the rigidity of the face, we see no improvement from THC from that. Here are some of the references involved. Feel free to take a look. And then when we look at CBD, we see that, once again, lots of randomized control trials. The motor symptoms, once again, we're not seeing a whole bunch of benefit from that in the research. We do see that some of the quality of life scores go up, and for some concern regarding the sleep behavioral disorders, so sleep disorders, we see some improvement with that. And then with Parkinson's psychosis, we see some improvement with that. Inflammatory markers did not go down with CBDs, which is important to note because CBDs are usually considered an antioxidant. So these are just different things to consider if that is something you're interested in exploring. Remember, CBDs at this point are a non-scheduled substance, so there's something that's much more accessible. It is a derivative of cannabis, but is not a controlled substance. Here's the studies on those if you're interested in taking a peek at those. We have another chemical within cannabis that is also considered to be neuroprotective, and this is one that you might see on certain labels if you are in an area that can have access to this. And we see that with this, that there can be some improvement in certain areas, but they a lot of these are preclinical as far as how they're looking at these. And the specific one that kind of came to the top of the list for these different breakdowns of different types of cannabis chemicals that are active ingredients is this delta 9 tetrahydrocannabinol, which is THCV. So with that one, what was interesting is they do believe that there is some neuroprotective effects, potentially some help with the nervous system, reducing motor symptoms, and that's kind of a more exciting thing because you don't really see that in some of the other cannabis byproducts here. There's also information here about whole plant cannabis and our synthetic THC pharmaceutical, the Nabilone. So different pieces there to take a look at. And here's some of the research about those different chemicals if you want to go back and read the actual studies.
There are so many phytocannabinoids, and there's about 120 or more. So this is just a smattering of three that Dr. Molly was talking through that are just starting to have some research on them. It's hard to research these plants when there is, when they're scheduled drugs or, criminalized federally. So it's just as that political climate is changing, we're able to get a lot of information, including medicinal studies on all the potential possibilities here. So stay tuned. This is definitely cutting edge stuff. So in terms of supplement support to consider, of course, check with your provider. We do have an apothecary here at our clinic in Port Townsend, Washington, otherwise available online with our physician-grade online store at prospernaturalhealth.com. We've got a couple of highlighted supplements here. Of course, we talked about the citicoline, that amino acid that helps with making dopamine. We've got another product known as Dopatone, which has that Mucuna pruriens, or that velvet bean, in its formulation. Ascorbic acid here we've got in powdered form or in capsule form, and that's the one that helps the absorption of that prescriptive levodopa. And then all the way on the left here is our adaptocrine, which we don't want to forget about. These are all of our adaptogenic herbs. This particular product has ginseng in it, holy basil, rhodiola, and so that is kind of like our stress supportive supplement that I don't want to forget about the importance here of that stress mitigation and mindfulness. If you want to know a little bit more, we have a lot of doc talks, which are public leaning lectures that Dr. Molly and myself put together, where we dive into the primary literature and talk to you about alternative and complementary therapies. Some ones that could be helpful here to refer to is one on dopamine in particular, what it does, what are some ways to support it, because dopamine is the one that activates our reward pathways. We highlighted it today because in Parkinson's, there's a diminished amount of it, but there's so much more to be known about dopamine. And then secondarily, you could look into our sleep support doc talk, which talks through all sorts of things to do with helping insomnia in particular. So feel free to give us a call here at Prosper Natural Health if you want to establish or talk to one of the docs about how we can be part of your care web in supporting your current conditions.
Thanks for joining today.